Good day and welcome. Welcome to NACTV's Coffee Chat. My name's Lyle Watson and we're pleased to have as our guest today Judy Gabler. Thank you for taking the time to join us, Judy, and welcome to Coffee Chat.
Thank you for this opportunity to come and promote our auxiliary, which I'm very pleased of, and all the good work that our ladies have been doing over 120 years. So.
Well, it's a very exciting year for the Neepawa and Area Health Auxiliary, of which Judy is the president of the board. So it's 120 years since the auxiliary started here in Neepawa. And could you just kind of give us a touch on what the mission and the vision was back then, and if it's changed any down?
Well, I can't quite say what it was 120 years ago, but now, our vision is that we will be able to supply our health facilities with equipment and supplies that just makes the work life easier for the staff and the patients as well. Some comfort. We know that like Prairie Mountain Health, which we're under now, is not able to budget for all the necessary equipment because as things date. There's always new ones. They make equipment so a few years down the road there's no longer parts available, so you have to buy a new one, and it seems that anything with a medical name to it, the price is fairly high. So that's what our mission is to do, and or mission and vision, I guess, is just to be able to help our facilities out with the equipment that they need to do their jobs. So.
Okay, so when you say facilities, it's not only the hospital then, what other
we have, of course, the acute care, the long-term care, the personal care home.
Yes.
We also do all the programs, the mental health, public health, home care, even the supportive housing, which is out of the Yellowhead Manor. There's one floor there is for supportive housing. We have funded things like TVs and different things for them in the past. We've also funded for EMS, the initial GPS that they had in their ambulances.
Yep.
The health auxiliary purchased. They purchased a chair lift, so if they had to carry somebody down a flight of stairs, it made it easier for them. Even for some community things like back where we would have trained staff to teach CPR and needing the resuscians that they had, so to train even our firefighters in our communities and the ambulance ones, the health auxiliary purchased a resuscian and a resuscitant baby. So
the health care vision, if that's not the right word probably, but it covers a lot of areas.
It's for all aspects, that I'm sure if when you go to get your blood taken, the chair you sit in for them to draw the blood was bought by the health auxiliary. Get an x-ray, we have a lead shield that we purchased to protect the technologists from getting too much radiation. And unfortunately, there's many that have gone through the chemo unit, but when the chemo unit opened, the chairs that they use in there now, the health auxiliary purchased those, and
so you covered a lot of ground.
Yeah,
and have left quite a footprint over the 120 years.
Yeah,
for sure.
So.
Now, the name of the organization is Neepawa and Area Health Auxiliary. So could you just give me a bit of background on area? Is there or was there area auxiliaries around, and how do you connect with Neepawa and area now?
Okay. In the past, when it did start, they did have branches off from the Neepawa Area Health. Actually, I could go back when it first started. It was Women's Health Aid Society.
Oh.
And then it was in 1946 when we became part of Manitoba Health Auxiliary Association. That's when we changed to the Neepawa Area Health Auxiliary. So, and then, yes, they had branches like in Franklin, Eden, Brookdale, Plumas, Burnie. To my recollection, Burnie was the last one, and it's just within the last 10 years that they disbanded.
Yep.
But ladies would get together in those communities, and they would sew pajamas or blankets or curtains, whatever was needed for the hospital.
Yep.
So that's, how the branches work, because of course, it was good socialization for the ladies.
Yeah.
Plus, for them to travel to one place wasn't quite as easy as it is now.
Yeah, yeah.
So,
You mentioned Manitoba Auxiliary. Now I see you have a history book here. Can you just touch on that briefly and what happened, or where is the Manitoba Health Auxiliary
yeah.
now?
So, 1946 was the inception of the Manitoba Health Auxiliary Association, and that came about because there was so many. Each community was kind of working on their own and doing similar things, but so they felt that there was a need to unify things and to get kind of the associations working towards common goals and just support for each other in different communities. So that started in 1946 after the war.
Yep.
And so then and unfortunately in 2016, 70 years later, the Manitoba Health Auxiliary Association has disbanded. So along with a lot of local ones, but I'm very proud to say our association's very strong, and we're gaining new members. So we're up to about 68, 69 members now. So
That's a very exciting part for me, because my understanding that you've been kind of growing as the years have gone by, and that pace of growth hasn't slowed. And like you say, you're up to 60 members. Probably the only organization in Neepawa where the membership is actually growing. I think I'm right in saying that. And it must make the auxiliary and make you as president and the executive feel good and positive about what you're doing.
it does, and we're probably maybe one that we're not all that visible out there, except maybe at this time of the year. Each year we are, because fall and September, October is when businesses will see our ladies coming around
Yep.
asking for donations, whether they can do a monetary donation or some kind of gift of some sort, and then then of course that's always when we have our fall raffle. So we see the ladies at the co-op store, the giant tagger,
Yeah.
bugging you to buy a ticket for so and that has been right from the get-go, according to the way I've read the history, is how they raise money was with
Yep.
raffle. It started with a hope chest that they would raffle off, and then once the hope chest got too expensive, they went to a jewelry box with a $50 check in it.
Okay. Yeah.
And now, we have monetary things.
So all your funding is done by fundraising locally.
Yes, we are a charitable organization, but we don't receive government grants or anything. It's all thanks to the good people in our communities. And you had asked about how the area, so we still, of course, with our area of Langford and North Cypress, Rosedale, Glenella, Lansdowne,
Yeah.
because those ones all pay towards our hospital for
Yes.
taxes and that. So those are the ones that we canvass out into those areas as well. So
Okay.
so that's why we kept the area, because that was a question actually at our last meeting, saying should we just be the Neepawa Health Auxiliary now? But no, because those different RMs, and they're very supportive too. So we're keeping the area. So
In terms of membership, Judy, is there a membership fee?
there is. It's $10 a year. So
Oh, is it? Okay.
yeah.
And how many times do you meet a year?
We have 7 meetings, so we meet January, April, May, June, September, October, and November. So we give a break for some of the colder months, plus our membership is all retired, other than we have some kind of associate members where the care team managers and of the health center and the care home, and then usually a representative from the community health that they come to our meetings and bring us
You mentioned
updates.
You mentioned a couple things. One was sociability and getting together and the benefits for mental health. It seems like the ladies, ladies auxiliary here seems to have a nice social aspect, and you have a few functions throughout the year, or is it every meeting where you have a social aspect?
No, every meeting we start with lunch, because so therefore, you know, they all have a chance to sit around and visit, and how even the selling of the tickets, they say, oh, it's so much fun because you get to sit at the places, you chat, there's always two people selling the tickets, and then plus all the traffic that goes by, and they chat, and they said it's amazing, you know.
Yeah.
You think, even don't realize how busy your local businesses are until you sit there for a while and see, and how far they reach, where people from all across Manitoba are coming through the doors and buying tickets and just being very supportive.
So aside from that social aspect, there's times in the year where you also host speakers?
We don't do the education one every year, and of course, thanks to COVID, and it's been a few years. So 2018, we had the speakers on MAID, the medical assistance in dying, and STARS at that time, and then we had just had one a week ago again on MAID, and palliative care this time. So
Yes.
so yeah, but there's been health fairs throughout the years too that we've had booths at, and so and we still fund a scholarship for a graduate from NACI that's going into a healthcare field. So
Just for our viewers' information, the MAID and Palliative Care program was filmed by NAC TV, and it is on our schedule this week. So if you're interested in watching it, and it was a very interesting program, just check out the NAC TV schedule, and you could tune into that. Yeah. Well, some of the things over the 120 years, or recent years, you have left a large footprint in our community in terms of fundraising and donating. What are some of the highlights of your donations in the last few years since you've been president, for example?
Well, like I say, all the donation dollars go towards the equipment, and I can't really just think of one donation because we're so appreciative for them all, whether it's, you know, we don't know where that's coming from, and we know these last few years have been pretty difficult for businesses and that. So but yeah, this example, I guess, looking back through different things we bought, one of the latest, few years ago, we made a motion to purchase an infant scale for the public health at $8,200 for one scale. You would think, oh, you could probably buy quite a few for that, but that's just an example of how much something costs. So I'd say on our business blitz, we take in about $10,000 to $13,000 a year, but as you can see, at $8,200, that's almost one piece of equipment, right? So and over the years, like we've been lucky enough that the Legion ladies have let us have a couple of suppers where we get the proceeds from that, and so the dollars were from our actual fundraising we have put into GIC, so that with the new hospital, we're hoping that we could maybe fund a family room, or you know, a special room that we could put our name on, saying that it was funded by the Neepawa Area Health Auxiliary. So
speaking of the new hospital, of course, it's going to be a real plus for our community, but the auxiliary is going to play a major part in being there or having a room.
Yes, and right now at the hospital we have a cupboard just as you come in the front doors there, where you could buy Kleenexes or toothpaste, or there's some homemade articles in there like baby blankets and different things that you could purchase. And all those funds go to the health auxiliary, but we're actually going to have a little store in the new facility that we haven't worked out all the logistics of it yet, about you know, who will be working and the hours that it would be open or anything. But you know, maybe we can showcase some local artisans or something in there too, with their things that we would get a little bit off of the what was made or commissioned, and yeah, so
Well, that'll
so
be
yeah, it'll be
interesting.
exciting. So
In terms of funding, and you mentioned family room, uh, could you fund that over a period of years, or does it have to be your participation all in 1 year? Like,
yeah,
could you?
yeah. Well, there's always the upkeep, right? If something like right now at the hospital, the palliative care room where our palliative care committee has been funding that, the furniture that's in it, and then of course things wear out and have to be replaced. So then, yeah, it's an ongoing thing. So
Okay, but if you had, if the project, or if there was a project within that parameter where it costs more than your 10 or 13,000 that
Yeah.
you can raise in 1 year, can you set up a format where you could do it over a 2-year or 3-year period?
if possible, I've asked Debbie Poole, who is the Prairie Mountain Health lead on the new build here, to come and speak to us in the spring to give us an idea of what we can do, what projects would be available. But I think if you had the majority of the cost, they would say it was yours, and then yeah, we could just keep adding to it. So
Adding to it, yeah, yeah.
just an interest thing when I was looking back in 1902 when the initial hospital was built, and then in 1903 when the ladies decided that they wanted to help out in some way, so a group of them got together, that in the first 3 years of their society they raised $3,500. They invested 1,000 of it into bonds, and then when they added in 1926, they added on a wing to the hospital that they cashed their bond in and were able to give them to help with the construction of that wing.
Yeah,
So what we've been doing, and I'm kind of at the last treasurer's report, that we've been investing in GIC. So we have about $50,000
saved.
invested that we would put towards
Wow.
a room or something at the hospital. So just the difference in money and,
Yeah.
just how.
But when you think about that, that's a substantial investment
Yeah.
for our community.
And so, and just so that people that, if the business is thinking, oh, now they're just investing all their money, that's all money that we raised through the gift cupboard at the hospital, through
Yeah.
our raffles, and through working at the Legion Supper. And one year the ladies got together and sold a whole bunch of pierogies, and
Yeah.
so that's what's in the GIC money.
Yeah.
And but all the money we receive from the businesses, and each fall goes towards the equipment. So
Yeah. So obviously, if a person becomes a member of the auxiliary, there's a lot of, I shouldn't say a lot of, but there's a number of functions throughout the year where they have an opportunity to volunteer and
Yeah.
give back to the community.
yeah,
too then.
oh for sure, yeah. There used to be more. Actually, the first baby clinics were started by the Women's Health Aid Society. So they did that. They had a doctor and a nurse come, and they put through maybe 100 babies that came and got checked up, and
Yep.
now that's all done through our public health. But yeah, that they used to do more at the blood donor clinics and flu clinics. But of course, as policies, procedures change with privacy and all those things, that we're not able to do that as much of that anymore. So, and blood donor clinics don't happen in every community anymore like they used to. And
No.
so
That-
I think the only thing that's still going strong and right from the get-go till now is the teas. We
Yeah.
have our annual tea, and so I'm going to put a plug in because it's happening on October 25th.
And that's open
So
to the public.
it's open to the public from 1 to 4 at the Legion. So
And you'll expect a good turnout there.
I sure hope so.
Yeah, yeah.
Yeah, and we don't charge an admission fee or anything, but there is we'll see a Rose Bowl on the center of every table, and people are very generous, and we
Yeah.
do well that way too. So
Looks after it.
yeah.
Well, I'm thinking of membership, and I'm just impressed with the number of members that you have for the size of our town here. But obviously that the membership in the Health Auxiliary has a lot to offer each individual
Yeah,
that's interested in
yeah.
and working within the community.
Yeah.
So
Yeah, it's
how-
giving back, and you know, a lot of our members have had some medical experience. You know, they're retired nurses, retired medical records. You know, different housekeeping, anything there, the public health,
Yeah.
community health, different things. But a lot of just ladies that want to make a difference in their community, knowing that healthcare is so vital to a community, right?
Yes,
If
yeah.
you have a hospital there, you're going to have
Yeah.
people coming and living here. So
Yeah. Yeah, no doubt about that. I think the new hospital is going to be a big plus for Neepawa becoming a regional center here,
Yeah.
and that's probably going to help enhance your membership too.
Well,
the way
yeah,
it's
I'm
going.
hoping. Yeah. So yeah, that's
The auxiliary itself, how do you keep in touch? Like, do you invite somebody from the health authority, somebody from the hospital, somebody from the care home? Do they come to each meeting and talk?
well, they're
about
definitely invited. But depending on their schedules, they aren't able to make every meeting, but that's one of the highlights of the meeting for them, just to keep up, come and report what's happening in,
Yeah.
you know, like the hospital. Sometime, you know, it was always a big thing of, you know, itinerant surgeries, surgeons coming, and you know what's happening there, staffing issues, anything that we can help out with. You know,
Yeah.
is there equipment? We don't just go and buy something, and we always, it's in collaboration with the managers, who of course they have to collaborate with the further up in the region too.
Yeah.
It's not always, you just don't get what you would like. Sometimes it has to be on the wish list, and you have to look into, you know, the sustainability. Is there a cost to keep that piece of equipment running? You know, is there extra supplies you have to buy for it? And
Yeah.
cleaning, that's the big thing. You know, can it be cleaned in the sterilization room and different things? So,
Yeah.
so
You know, as members of a community, quite often we take things for granted, and we don't know the ins and outs or the details of what makes certain things function, and the success or the lack of success, for example. But being a member of the Ladies Auxiliary, I could see where it would be an opportunity to keep in touch with the community in terms of all the care facilities and kind of what's going on in that area, and nice to be up to date.
yeah, even like you said, community doesn't realize what all it does. Even some of our own members, when we ask, or the managers come and say, you know, when they bring their wish list to us, and they were, you know, different ones would say, well, why that should be the regional health authority should be supplying all that stuff. And yes, they should, but Prairie Mountain Health has 73 facilities
73.
with personal care homes, hospitals, primary care clinics, and
Yeah.
you know, all the programs. And so their budget isn't going to allow them to be able to meet everybody's wishes.
No.
So that's why they really do rely on donations. And I know once regionalization came into being, from being on the other side and working in it and in managing, people saying, well, I'm not going to give to them because we don't want the CEO buying jewelry or something, which I can assure you that never ever happened. And
No,
even that, if you donate to the Neepawa Health Center, it's stayed designated for the Neepawa Health Center. But if you give to the Neepawa Area Health Auxiliary, it's definitely going to stay in our community. So
Yeah.
so we are a nonprofit, and we give charitable receipts and things.
You
so,
do, yeah. Well, it's interesting, and like I say, the membership just astounds me, and I hope that you continue on for another 120 years, and with the same success as we've seen in the past.
Yes, well, and you know, and
And,
we're definitely an independent association now, because with the Manitoba chapter closing, that
Yeah. So you don't have any connection with any other auxiliaries across the province at all? Then?
no, not anymore. There always used to be, as long as the 70 years that was in effect. They would have an annual convention or meeting every fall, and with some education
Yeah.
component to it. So, but no, we're out there on our own now. So back to the way it was, I guess, prior to 1946. So.
And for Neepawa area, we're very fortunate that you have been able to continue on, especially at the number of members that you have at this point in time. But it's not the end of the world being on your own either.
No.
When you're serving an area, is it?
No, we keep the same vision and mission, and so that's.
So you're looking forward to lots of excitement in the new hospital with
for sure.
that coming.
Yeah.
And that's going to be done by what year was that projected?
Well, they said 2025, but we haven't quite heard yet if that's extended or not. But it's a huge facility, so it is
one
pretty
thing we
exciting.
can feel good about, Judy, is that you can see the progress.
Yes,
in the building. You drive past now, and you can see work is being done.
It is.
So.
They're really moving now. So I'm. Trying to get it filled in enough so they can work all winter, I think. So.
Well, that would be nice. Well, as usual, our time gets a little short, Judy, and I would like you to sum up with a thought that you may have for our viewers, whether something about the ladies' auxiliary, or it could be fundraising or membership.
Yeah.
If you could share a thought with us.
Well, like I said, I'm very proud of what we've accomplished, and we have visions for accomplishing much more. And if there's anybody interested out there that wants to become a member, you can contact myself. Or the next meeting is November 7th at 11:30 at the Neepawa Legion. We start with lunch, and then the meeting to follow, we have our annual tea and raffle where it will be drawn next Wednesday, October 25th at the Legion, 1 to 4. I'm thinking our committee there is going to be doing something special for the 120.
Yeah.
And so. And again, like I said, we are a nonprofit organization. We do give charitable receipts. It's coming to the end of the year. If anybody needs to get rid of some money, then we'd gladly take it.
So you don't have to wait for a special fundraising project in order to donate if you're so inclined. You can donate anytime throughout the year.
And all the money is kept here for our own, either the care home or the hospital or something through public health and community health.
And there will never be an end to that need within our community.
Never, no.
I think the future is bright for the next 120 years, and we thank you and the present executive for participating and doing a very good job of what's happened over the last number of years, Judy. And we wish you the very best in the future with the health auxiliary and the new hospital. And I'm looking forward to the day we can go in and see the gift shop set up and a nice family room, because that in itself is a real plus for a regional type hospital. Well, for any hospital, that family room can be very important.
Yeah. Well, thank you. And of course, my job is made so much easier with the wonderful women I have behind me. So thank you to them.
Yes. Well, it takes a team, and like I say, I'm just so impressed with your membership numbers, and I hope we could sit here a year from now and see that number grow.
Yes, that would be great. So.
It would be good.
Yeah.
Thank you for joining us.
Thank you.
Yes. Well, that concludes our coffee chat with Judy Gabler and the Neepawa area Ladies Health Auxiliary, and we're very pleased that they're celebrating 120 years and their membership is growing. So if you have any interest or any questions, don't be afraid to give Judy a call and check out and get some information. You might even want to sit in on a meeting. Okay, till next time, my name's Lyle Watson. Take care and have a good day.